Well, meantime, the Biden administration is investing $3.2 billion to develop antiviral pills for COVID. Now, these pills would fight the virus early on, potentially saving a lot of lives. Joining me now is K-Rock Consulting President and CEO, Dr. Kevin Campbell. Good to see you, Doctor. Thank you for being here. How close are we to an anti-COVID pill?
So these types of antiviral pills that you can take by mouth, obviously, have been around for the flu, for instance. You've heard of Tamiflu. And what it does, it doesn't cure the disease, but it lessens the symptoms. It shortens the duration of the illness. And I think we're actually pretty close. Pfizer has a drug that is in preclinical testing that I think could be available probably by the end of the year, early next year, to do just that.
So would this turn COVID into something similar to the flu itself, to the influenza that can be deadly but usually isn't?
You know, I think it's all about vaccination. And I think the key to this whole thing is vaccinating everyone. However, those who choose not to get vaccinated, who get COVID, or in the rare case of a breakthrough case, being able to use these oral agents to lessen symptoms will make a huge difference. And yes, in a way, it would be more similar to the flu. If you get a vaccine, you're more likely to have a lighter case or a less serious case, and using these antivirals are likely to help lessen those symptoms.
Now, I had COVID. I took the Regeneron what do you call it? The antibody treatment, the infusion. Within 24 hours, my symptoms disappeared completely. Same was true with my wife. And as a result, I have the antibodies still in my system. And when you have other drugs like this new pill coming online, could it be that a lot of people will opt not to get a vaccine and just say, look, I could deal with COVID if I get it?
I'm hopeful that they will not, because again, vaccination is the cornerstone. What we want to do is prevent you from getting it in the first place. What these drugs do, particularly the one that's in development, it's called a protease inhibitor. It's a fancy word for what it does is it inhibits the ability of the virus to replicate or reproduce within your body. So the viral load is much lower, so your symptoms are less. High viral load equals higher, more virulent disease. So I hope that folks will not get the idea this replaces vaccine. It's another tool in our toolbox that we can fight the COVID with.
Let's talk about how this drug is being developed, because Operation Warp Speed was so tremendously successful. Everybody doubted President Trump saying that we'd have the vaccine within a year. They said, no, that's nonsense. It's pie in the sky. Turned out he was right. Is Operation Warp Speed now our template for developing new antiviral drugs, and, for example, for developing any drug that is necessary to kill disease in our society?
I could not agree more. I kind of reckon this to be next to what it was like to be a citizen during World War II. We mobilized our resources. We mobilized industry. We cut some of the red tape, and we were able to produce the items we need to win that war. Now we're fighting a war against COVID and other viruses, and by mobilizing the ability of industry to, through money and grants and researchers and scientists, to get these to market faster, that's why Warp Speed worked. And I think this can work again. What we're doing is we're making sure that the best and brightest get the money first. We're making sure that the most likely successful treatments get more funding. And then we're cutting through some of the red tape that we get bogged down in our FDA. So I am all for this.
And letting our magnificent free market system work against this, as no other system has been able to work as well as ours has on this. Dr. Campbell, great to see you. Thank you very much for being here. Very optimistic report. I appreciate it. Well, inflation is here.